Over 10,000 tons of assorted drugs and secure the conviction of 11,628 offenders.
This is the third edition of the training workshop organized by NDLEA for the Nigeria Governors Spouses Forum in Abuja. At the workshop, which took place at the Army War College, Nigeria, state government were charged to embrace and entrench community-based interventions that will curb the impact of the scourge of substance abuse and illicit drug trafficking at the grassroots in line with the National Drug Control Master Plan.
Here to represent our dear Mother of the Nation, Her Excellency Senator Oluremi Tinubu CON, who is unavoidably absent due to other commitments, but she sends her warmest regards to all of you.
In a keynote address, the special guest of honor, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, who was ably represented by wife of the Deputy Senate President, Ajia Laila Jibril Barau, commended the NDLEA and the NGSF for the initiative aimed at advancing drug control efforts to the grassroots across the country.
Let us always bear in mind that as state first ladies and mothers, you owe our people the duty to lead by example, to bear their burden and share in their pain as we jointly confront drug abuse in our society. I urge us to continue to provide the right direction through prevention initiatives, advocating for those whose voices have been silenced by addiction, providing community interventions to support recovery and reintegrate people into communities after treatment. In conclusion, let us approach the formidable task ahead with humility, doggedness, and commitment to enable us build communities where our children are protected from harm and empowered to thrive. Together, we can change the narrative, restore dignity to our communities, and ensure a healthier, safer future for all Nigerians. On this note, I declare this workshop on community-based drug use, prevention, and treatment open.
In his welcome address, the chairman and CEO of NDLEA, retired Brigadier General Marwa, noted that the drug scourge struck progress and deems prospect in an already beleaguered world. He expressed confidence that the training will strengthen capacities, enhance community resources, and unlock the potential needed to formulate and implement evidence-based interventions that will salvage and rejuvenate every segment of beleaguered communities.
And secure the conviction of 11,628 offenders. Furthermore, 1,330 hectares of cannabis farms were identified and destroyed. To ensure a balanced approach in accordance with international best practices, equal emphasis has been placed on drug demand reduction. Between January 2021 and March 2025, a total of 24,375 drug users received counseling and treatment at NDLEA facilities. Since it is at the community level that the burden of the drug menace is most acutely felt, it is vital that stakeholders, including all of us gathered here today, address the different dimensions of the problem from a community-centered perspective. This gathering must strive for common ground, developing indigenous and pragmatic solutions that go beyond mere statistics and harrowing headlines, and addressing instead the real and harrowing human toll of drug abuse.
Also speaking at the workshop, UNODC country representative reminded the First Ladies that their influence transcends politics. He urged them to channel their unique power into 3 pillars of action.
Influence transcends politics. You are the custodian of trust in your states. When you speak, community listen. When you act, local government follow. Today, I urge us to channel this unique power into 3 pillars of action. Number 1, state-led resource mobilization. Every state must prioritize dedicated budget for prevention and treatment. This means establishing a state-specific drug control task force to align with NDLEA's national efforts, allocating local government funds to build community drop-in centers, safe space for counseling and care within walking distance of those in need.
Because the involvement of governors' spouses is critical. You are the forefront of advocacy and social intervention in our respective states. You understand the drug issue deeply from the natural perspective point of view, and you approach it with compassion and natural care, and also with the qualities that are essential to deal with the situation. We remind ourselves of the outcome of the 2016 United Nations General Assembly Special Session on Drugs, that is the August 2016, which recognized that drug addiction as a complex health disorder, one that is both preventable and treatable. And that gives us a kind of hope that it can be treated, it can be prevented.
And as I said earlier, we had taken sensitization to schools. And presently, if you notice, the governor has been vocal about cultism, kidnapping, because you realize that all these things kind of are related to drugs as well. So for us as a state government, we have been working tirelessly to tell the youth that drug does not pay. What one of the ECOWAS representatives said, the high is a lie. So whatever you feel after taking drugs is a lie, because it wears out after a while, and then what next? You find yourself being, I always tell the youth when I talk to them that after the high, you're worthless and useless. So we have been trying to tell our people that let's not take these drugs, let's be more productive. And we have also opened a lot of skill acquisition centers so that
Experts who served as resource persons during the technical session of the workshop include Dr. Kule Adeshino, Dr. Ngozi Madubueke, Dr. Abubakar Salami, among others. Olaimi Eson, First Spy TV.